Over the past several years, cancer rates have continued to rise in many parts of the world. More families are facing a diagnosis, and more people are beginning to ask deeper questions about how cancer actually develops inside the body. For decades, most conversations about cancer treatment have centered around one primary idea: destroying the cancer cells. That approach has led to important advances in medicine, but over the last 20 years, research has also begun revealing something deeper. Cancer is not only about the cells themselves, it is also about the environment those cells live in. Hi, I'm Dr. Rumbidzai Mudzonga, co-founder of New Legacy Natural Medicine, an integrative medical practice where we focus on understanding the terrain that influences chronic illness and cancer. One of the most important insights emerging from modern research is that cancer does not develop in isolation. It develops within a complex biological environment inside the body. Scientists often refer to this environment as the body's terrain. This terrain includes many of the biological systems that influence how cells behave, including immune activity, inflammation, oxidative stress, cellular communication, and the signaling pathways that regulate growth and repair. When this terrain becomes disrupted, it can create conditions that allow abnormal cells to grow, adapt, and survive. Because of this, researchers have increasingly expanded their focus beyond single target approaches. Instead, they have begun studying compounds that interact with cancer biology in broader and more dynamic ways. One compound that has attracted significant scientific attention is artemisinin. Artemisinin is a naturally derived compound that comes from a plant called sweet wormwood. It has been studied in medicine for decades, particularly in infectious disease research. In more recent years, scientists have become increasingly interested in the ways this compound interacts with biological systems involved in cancer. This growing interest has led researchers and integrative physicians to explore artemisinin as part of a much larger conversation about how the body's terrain influences cancer behavior. Instead of focusing on a single pathway or target, this research looks at the broader biological environment and how different compounds interact with that terrain. But there's an important part of this conversation that most people never hear about. Understanding that compounds like artemisinin are being studied in cancer research is only the beginning. The real question is how compounds like this fit into a broader integrated strategy that considers the terrain of the body as a whole. That is where the conversation becomes far more interesting. Because of that, I created a free guide that walks through the science behind artemisinin and explains why this compound has attracted so much attention in integrative oncology. If you would like to understand what researchers are discovering and why this conversation continues to grow, you can download the free ebook by clicking the link below. Inside the guide, I explain the research and show how artemisinin fits into a larger terrain-focused approach to cancer biology. Click the link below to download your free copy today.